Hi friends, Dr. Tejal Pandya here, talking about all things heartburn and reflux disease. And I wanted to share a story with you about a patient that I saw today in the office that I think is very relatable. This was a gentleman in his early 70s, and I would say that he was kind of a young 70. And he came in because he was having reflux and heartburn symptoms. Now, the thing that he noticed that kind of convinced him to come and see me is that in the recent past, his doctor had been trying to help him wean off of PPI medication. Those are proton pump inhibitors, and those are the medications like omeprazole, esomeprazole, medications with similar endings that sometimes are known as Prilosec, for example, Protonics. These are medicines that 100% block the acid production from the cells in the stomach. And he had been on those medicines. Once he started thinking about it, he realized it had been at least 10 years, if not more. And his primary care doctor was helping him wean away from that so that he could return to a little bit more normal physiology. Remember that stomach acid is naturally occurring. It belongs in the stomach. The stomach is built to handle it. And there are nutrients and other functions that require an acidic environment. And so blocking stomach acid is not a natural situation. The thing that the patient noticed that I think many people would find relatable is that he tried to stop his medicine. His aim was to switch completely over to a different class of medicines called H2 blockers. That's things like Pepcid or famotidine, for example. And these do not 100% blockage of the acid production in the stomach. And he thought that that would be a little bit more of a balanced approach for him to take care of his symptoms, as well as have a little bit more normal environment in his stomach. Well, guess what? He switched over cold turkey and it did not work for him. He was wildly symptomatic. He was having heartburn and pain and pressure in the chest. He is able to feel fluid moving up and causing irritation in the throat and in the chest. And he realized that he was going to have to wean himself and he was going to have to see how far he could go. So that's what this patient's been up to recently. And that made him realize that he had truly become dependent on his proton pump inhibitors. And he didn't like that. He was not happy to realize that that was the condition that he had come to be in. And it happened slowly over time, and he almost didn't realize it until he tried to make that switch over. Another thing that this person relayed to me was that he realized that his heartburn should be taken more seriously because his neighbor was diagnosed with esophageal cancer. And in talking to his neighbor, he discovered that that person also had a lot of heartburn and reflux disease for many years and perhaps didn't really get any specific type of treatment for that, and has now resulted in this cancer diagnosis. Hard to say since we don't know that neighbor and we don't know that person's health background, but in this country, in the United States, the most common underlying disease that changes a person towards esophageal cancer, or specifically esophageal adenocarcinoma, is reflux disease and the changes that are part of that problem set. And so it's totally reasonable to hear this story, to have this experience, to be talking to your friends and neighbors and become worried. And so luckily this patient decided that it did make sense to come in and see somebody like me. And we had a really great discussion. Specifically, one of the things that I let him know about, especially with relation to the story about his neighbor, is that we're not just concerned about his symptoms, we're concerned about the development of Barrett's esophagus, which is a change in the cells of the esophagus, which lets us know that precancerous transformations are starting to occur. To be very specific, Barrett's esophagus is a change in the cell type in the lining of the esophagus. And Barrett's esophagus is not cancer. It's not a precancer. It is a completely different type of cell that normally does not live in the esophagus. And this change only occurs when there has been so much injury, so much harassment, so much inflammation from the reflux disease occurring over a prolonged period of time, which allows the body to realize, hey, this isn't going to stop. This process is ongoing and I'm going to have to do something for myself in order to prevent dangerous additional changes to occur. And so these cell changes that are part of Barrett's esophagus occur because it allows the body to put cells that have more properties where they can secrete soothing materials to help neutralize that acid irritation that's going on. Now, if your body, which is very smart, our bodies are very smart. So if our body is going out of its way to change its own character in order to try its best to prevent cancerous changes, you know that that's a serious situation. And that's what Barrett's esophagus indicates for us. So if we find that when we do an endoscopy on someone, that Barrett's esophagus is telling us that, hey, this person is on a pathway to continue towards cancerous changes in the esophagus from this reflux disease if we don't do something more specific to stop that process. So we had that whole discussion. Now, when it comes to Barrett's esophagus, heartburn, reflux disease, knowing that you have it, feeling it, is a significant risk factor. But there are several other risk factors, which I'm going to put on the screen for you here. Now, it's important to realize that not everyone that is at risk for Barrett's esophagus is going to be positive on every risk factor. And in fact, it is possible to have silent reflux or reflux of acidic material into the esophagus that you don't feel, and yet may be putting you at risk for Barrett's esophagus. And this is how you might hear stories about people who were completely fine, never had any problems, and then one fine day can't eat properly and discover they have an esophageal cancer. This is a terrible story that we never want to have to hear from someone that we know and care about. But it is a type of story, a category of story that happens because of exactly this reason. So while reflux disease is a significant risk factor, it's not the only one. If you have 2 to 3 of these that are listed here, even if heartburn is not one of them or reflux disease is not one of them, you're still at risk for Barrett's esophagus. And this patient that I saw today had 2 risk factors: age, as well as his significant long-standing reflux disease that was being, at this stage, undertreated. And so as a result, he is appropriate for screening for endoscopy for 2 reasons. One is for his Barrett's risk, and the other is for his symptomatic reflux disease that we would like to find a more permanent solution. So I hope that this story helps illustrate for you a common situation that I think a lot of people out there are in as far as their symptoms are concerned, and understanding how that plays into the cancer risk. There's 2 categories of things that I'm thinking about when I see patients like this, and that is, 1, I want you to feel better. I want you to feel better. I want you to be able to eat well. I want you to enjoy your life. I want you to be able to be on as less medication as possible in order to function normally and be healthy. And at the same time, I want to make sure that we're not missing cancer risk that is preventable and that we're screening the appropriate people. And so those are related, but 2 separate reasons that I have for doing endoscopy and doing examinations and workup on people. And one of those people might be you. So think about it, see if you have any questions, drop them below, and let us know in the comments if you have 1 or more risk factors for Barrett's esophagus. I hope that makes sense, and I will see you next time.